Good day, everyone. Welcome to Week 5, Unit 4 of NSC 303 course. Today's discussion is titled Organization of Health System Based on PAC. And the following learning goals for Unit 4 will be achieved by the learners. After studying this unit, that is Unit 4, learners should be able to define health system, list the characteristics of health system, describe the organizational structure of health system at federal, state, and local levels, and explain the roles and organization of National Primary Health Care Development Agency. You will understand that in Unit 1 of this course, when we first began the semester, we discussed the concept of health, which is a complete state of physical, mental, social well-being, and not merely the absence of disease or infirmity. That was according to WHO in 1946. In the following week of the semester, which we covered Unit 2. Unit 2 dealt with concepts and principles of primary health care, while in Unit 3 we learned that in 1977 30th World Health Assembly decided the main target of government and WHO in the coming decades, and that was health for all by the year 2000 AD. In this Unit 4, we will discuss the definition and essential characteristics of health system, organization, health system structure at federal level, the state level, and the local government. I also feel it is important for us to know that Unit 4 will be divided into 2. This week we are covering part 1 of Unit 4. Next week, by God's grace, we'll cover the part 2 of it. So mainly this week, we are just going to look at the organization, health system, and the structures alone. So by next week, we'll move to the part 2 of this unit. Meaning and characteristics of health system. Health system is simply defined as a coherent whole of many interrelated component parts, both sectoral and intersectoral, as well as community itself, which produces a combined effort on the health of the population. If you try to understand the above definition that I just defined for you, you will be interested to learn the interrelated component parts. That is the component of health system, which includes the following: concepts, ideas, objects, and person. These are the 4 basic components that are related, interrelated with health system. And together, this forms a unified whole in which all the components interact to support one another. Of all these components mentioned above, that I just mentioned, we will only discuss the objects and the person. The health system aims at delivering the health services to the beneficiaries. It constitutes the management sector and involves organizational matters, and also in allocating resources, relating policy into services, evaluation, and health education. The aim of health system is health development, which includes continuous and progressive improvement of the health status of the population, that is, community. Health system encompasses promotive, preventive, curative, and rehabilitative aspects, and also cater care of the extremely disabled and incurable. Now we move to the essential characteristics of health system. And the following are the characteristics of all health system based on PHC, that is primary health care. 1. The system should encompass the entire population on the basis of equality and responsibility. It should include components from the health sector and from other sectors whose interrelated actions contribute to health. That is, for example, educational sector, public sectors, animal husbandry, and agricultural sectors. Health is a subject of overall socio-economic matters of the community. Primary health care. Primary health care consisting of at least the essential elements included in the Declaration of Alma Ata should be delivered at the first point of contact between individuals and the health system. At intermediate levels, more complex problems should be dealt with, and more skilled and specialized care as well as logistic support should be provided. Better trained staff, that is supervisory staff, should provide continuing education or training to PHC workers, as well as guide the public of different communities and community health workers on practical problems arising in connection with all aspects of primary health care. The central level should coordinate all parts of the system and provide planning and management experts. It should also provide highly specialized care, teaching for specialized staff, the staffing of such institutions, that is, as central laboratories and central logistic and financial support. If you think deeply for a while and analyze what do these above mentioned characteristics indicate? This clearly indicates that health system is not a separate entity. It includes components and actions not only from the health sector, but also from other health-related sectors such as agriculture, education, environment, animal husbandry, communication, and so on and so forth at various levels. Structural organization of health system. The health system in Nigeria is organized at 3 levels: federal level, state level, and local government level. And so quickly, we are going to unpack each of these levels that is the federal, the state, and the local government level. Organizational level at federal uh, level. The social organization of the health system at the federal level consists of two. One, the Federal Ministry of Health, and two, the National Council of Health. We're going to look at the function of each of these levels, of this sub division of federal level. The function of Federal Ministry of Health. The Federal Ministry of Health, as headed by a minister. This department is headed by a minister. It is a political appointment. Currently, the Federal Ministry of Health has 5 directorates or departments, which includes Department of Personnel Management, Department of Finance and Supplies, Department of Planning, Research and Statistics, Department of Hospital Services, and lastly, the Department of Primary Health Care and Disease Control. Responsibilities of the Federal Ministry of Health. In addition to different departments that comprises the Ministry of Health, they also have responsibilities, duties to the nation. And we are going to look at this responsibility. One, to take the necessary action to have review national health policy and its adoption by the federal government. They are the ones that will look at the national policy that the federal government has adopted. They review it on a regular basis. Devise a broad strategy for giving effect to the national health policy through the implementation by federal, states, and local government in accordance with the provisions of the Constitution. Submit for the approval of the federal government a broad financial plan for giving effect to the federal component of the health strategy. Formulate national health legislation as required by the consideration of federal government. Act as coordinating authority on all health work in the country on behalf of the federal government with a view to ensuring the implementation of this national health policy. Assess the country's health situations and trends. Understand the related epidemiological surveillance and report thereon to the government. Promote an informed public opinion on matters of health. Support states and through them local government in developing strategies and plans of action to give effect to this national health policy. Allocate federal resources in order to foster selected activities to be undertaken by state and local governments in implementing their health strategies. And lastly, issue guidelines and principles to help states prepare, manage, monitor, and evaluate their strategies and related technical programs, services, and institutions. Define standards with respect to the delivery of health care, monitor and ensure compliance with them by all concerned. Health technology, including equipment, supplies, drugs, biological products, and vaccines in conformity with WHO standards, the human environment, and the monitoring, education, training, licensing, and ethical practices of different categories of health workers. Promote research that is relevant to the implementation of this national health policy and state health strategies, and to this end, to establish suitable mechanisms to ensure adequate coordination among the research institutions and scientists concerned. Promote cooperation among scientific and professional groups, as well as non-governmental organizations, in order to attain the goals of this policy. Monitor and evaluate the implementation of this national policy on behalf of government and report the findings. International health. The Federal Ministry of Health shall set up an effective mechanism for the coordination of external cooperation in health and for monitoring the performance of the various activities in the overall foreign policy objectives. This national health policy shall be directed towards: 1. Ensure technical cooperation on health with other nations of the region and the world at large. Ensure the sharing of relevant information on health for improvement of international health. Ensure cooperation in international control of narcotic and psychotropic substances. Collaborating with United Nations Agency, Organization of African Unity, West African Health Community, and other international agencies on bilateral or regional or global healthcare improvement strategies without sacrificing the initiatives of national, community, and existing institutional and other infrastructural arrangements. Working closely with other developing countries, especially the neighboring states within the region which have similar health problems, in the spirit of technical cooperation among developing countries, especially with regards to exchange of technical and epidemiological information, sharing of training and research facilities, and the coordination of major intervention programs for control of communicable diseases. The National Council of Health. The National Council of Health is composed of the following members: 1. The Honorable Minister of Health. The Honorable Commissioners for Health. The following are the functions of National Council of Health. The National Council of Health advise the government of the Federation with respect to the development of national guidelines, the implementation and administration of the national health policy, and the various technical matters on the organization, delivery, and distribution of health services. The Council is advised by the Technical Committee. Who are these technical committee? The Technical Committee of the National Council on Health is composed of the Federal and the State Permanent Secretary, the directors of Federal Ministry of Health, the professional health heads in the state ministries of health, a representative of Armed Forces Medical Services, Director of Health Services, Federal Capital Territory, Abuja. Expert panels. The technical committee is set up as required. Appropriate program expert panel, including the representatives of health-related ministers, agriculture, rural development and water resources, education, science and technology, labor, social development, youth and support, works and housing, national planning, finance, health-related bodies, National Institute of Medical Research, medical schools, schools of allied health professionals, non-governmental organizations, professional associates, that is health. State level, that is, we've just covered the federal level and their functions. Now we are moving to state level. At present, we know that there are 36 states plus the Federal Capital Territory, Abuja, and many types of health and many types of health administration. In all the states, in all these 36 states, the management sector for health lies with the Ministry of Health, while in some states, Health Management Board also participates in the management. State Ministry of Health Organization. State Ministry of Health Organization is headed by an honorable commissioner, while in Health Management Board, there is governing board with an executive secretary. The commissioner is the political head of the ministry, while the permanent secretary is the administrative head. There are directors manning the directorates, assisted by the deputy and assistant director. Functions of the State Ministry of Health. The state ministries of health direct and coordinate authority on health work within the state via ensuring political commitment, ensuring economic support, winning other professional groups, establishing a managerial process, public information and education, financial and material resources provision, intersectoral action, coordination within the health sectors, organizing primary health care in communities, federal system, logistics system, health manpower recruitment and retaining. Last, priority health programs, and lastly, health technology. Now we move to local government level. In Nigeria, there are 774 local government areas with various health facilities operating under the hands of primary health care. The local government headquarters coordinates the activities of the health facilities, providing manpower, funds, logistic, site control. The local government is headed by elected chairmen during political era with council members. Supervisory councillors are also appointed to oversee various aspects of local government activities, including health and social services. The health department is always headed by a primary health care coordinator. What are the functions of local government level? At local government level, functions of local governments: 1. Provision and maintenance of essential elements of primary health care. Environmental sanitation, health education, design and implement strategies to discharge the responsibilities assigned to them under Constitution to meet the health needs of the local government, of the local community, under the general guidance, support and technical supervision of state health ministries. Motivation of the community to elite the support to elect the support of former and informal leaders. Local strategy for health activities. Examine this illustration, which provides an overview of healthcare delivery system at the 3 levels of healthcare. That is the primary, the secondary, and the tertiary levels. As you know, a full range of primary health care are being rendered through the agency of PAC centers. Secondary health care is being provided through the establishment of a cottage general hospitals where all basic specialty services are being made available. Tertiary care is being provided at the teaching and specialist hospitals where super specialty services, including the sophisticated diagnosis, specialized therapeutic and rehabilitative services are available. We've come to the 3 levels of the health system that we have in Nigeria, and we have unpacked each, and we have looked at each of the function, and that is where we are going to stop this week. By God's grace, next week we will continue the part 2 of this unit 4. And I want to say thank you for watching, for listening, and for reading your instructional videos. See you in the class session. God bless.